Hello from Thailand. We are high school students from Princess Chulaporn Science High School, Mukdahan. First of all, I would like to introduce our team.
My name is ชนาทิพย์มณีกระโทก
My name is สรกุลมิมจันทร์
And my name is Nathawadi Khiawkrai.
Our advisors are Mr. Tiwut Thanapan and Mr. Sawit Bongpo.
We proudly present artificial intelligence for CT scan analysis. Brain disease is caused by the abnormal functioning of brain cells. This disorder in the brain has affected the brain's working and nervous system. Furthermore, brain disease can be treated specifically in the hospitals that provide a CT scan machine. Moreover, medical personnel and specialists in brain cell and nerve system should be provided. So, we decided to use this machine learning to give us advantages by these three reasons. Firstly, to diagnose the brain disease. Second, to reduce the risk of diagnosis that can be mistaken. And the last one is to diminish the time in diagnosis of brain disease.
There are three objectives in our project. First is to use machine learning to diagnose brain disease from CT scan images.
Working principle. We will import the image into the program and place the button to analyze. The analysis result will be displayed on the screen.
Second, to design a machine learning code in the diagnosis of brain disease based on CT scan images.
The code of each model will have different equipment. The equipment is that the working device of each model will be as follows.
In the first model, consists of adaptive moment estimation, but normalization and dropout, whereas in second and third model were without dropout and bar normalization respectively. In model 4, consists of natural, accurate, adaptive moment estimation, bar normalization and dropout, whereas in model 5 and model 6 were without dropout and bar normalization respectively.
And the last is to study efficiency and accuracy of imaging for the diagnosis of brain disease using CT scan images.
The PyCharm application has been used to test each model. In this graph, it shows information about the base model, which is model 4, that optimized with NADAM optimizer, batch normalization, and dropout. We will see and consider at F1 score in this model 4. In these three tumors, the first one, meningioma tumor, is 0.9274. Pituitary tumor is 0.8702. And the last one is no tumor. F1 score is 0.9231. And the F1 score for each model that is shown apparently in this graph, that as can be seen, model 4 was the most efficient of all the models. It comes with NADAM optimizer, which combines all of the optimizers by removing faults and adding energy to speed up the timing of the image's color level. Then there is batch normalization, which involves adjusting the shift and scale of the activation in the higher layer of the neural network to ensure that it's the right size. Dropout is the last of these. It's one technique to standardize our model by lowering visual memory, reducing overfit, and improving its appearance.
Here are 4 things to make sure that our model is efficient. The first one is accuracy of the model. We will use the sum of the true positive and true negative divided by all test values. And the second one is F1 score is the harmonic mean between precision and recall. It is created as a single metric that measures a model's ability. No need to choose between precision and recall because the average has been given. And the third is precision. It is a measure of accuracy of data by considering each class separately, which is we will use true positive value divided by the sum of the true positive and false positive values. And the last one is the recall. It is a measure of the accuracy of a model by considering each class individually. And its formula is true positive divided by the sum of the true positive and false negative values.
In this project, we will use the confusion metric to measure the ability of our model in the classification of the data. It involves 4 types of data. First, TP, stands for true positive. It's what the model predicts as true and it's correct. Second, TN stands for true negative. It's what the model predicts as false and it's correct. Third, FP or false positive is what the model predicts as true but it's incorrect. Fourth, FN or false negative. It's what the model predicts as false but it's incorrect.
Let me inform you of various benefits in this machine learning are contributing. First one, reduce the time to diagnose brain disease of the medical staff. Second, build credibility with the medical staff and patients. Third, to be a great facility for the medical profession at the hospital as well. Fourth, it can be analyzed as a tumor or a cancer based on the growth trends. And the last one, it can apply to the treatment of other diseases diagnosed by a CT scan.
This is the end of our project. Thank you for having us.